Indigenous Intertribal Bisoma Acupuncture. I came up with these names. I hope it's acceptable. Okay. Because it's something that we could all share, and these are all natural medicine, and therefore it comes from somewhere in certain groups of people. And natural means we help the body to help itself. That's what it means. Natural is not intervention. What's good with intervention is biomolecular medicine, but we've been doing natural medicine all this time, meaning the body has a potential to do its job, and we're tapping into that ability. Okay. One of the examples is acupuncture. And like the title says, 2 sets of acupuncture points for all problems as possible. Okay. All right. 2 sets of acupuncture points. It's that easy. It's like flipping a coin. Either one set works or the other set works. That's simple. Now let's get into, yeah, these are the points. Set 1 is large intestine 1, set UB66, gallbladder 41, small intestine 5, stomach 36. Set 2 is gallbladder 44, small intestine 2, stomach 43, large intestine 5, and UB 40. These are all the points you have to know. There are more points that you could know, but that's another subject, another level for more comprehensive approach. As with this is comprehensive enough for an acupuncturist. If you're just doing acupuncture only, this is enough. These are the points on the hand and the legs. You could do acupuncture on the head, back, neck, on the abdomen. You could add them all together along with this. This is comprehensive, but not limited. Why is it called Bisoma Acupuncture? Is because Bi means two and Soma means body. There are two bodies, two types of bodies that accept set 1 and accept the set 2. But no body accepts set 1 and 2 together. This is an example of what I do when I do acupuncture outside of the clinic at events. People on their zero gravity, you could see 5 people. Last weekend, June 1st and May 31st, for 2 days, we were treating 6 or 7 people at once. And that's something I'll go over later. This is an example of record keeping. I think we use this for before and after, and we were trying to get a phone app that we could all share so that we could continue to treat the patients that we've treated, and it's easily accessible. And you don't have to start all over. You don't have to ask the patient what was done. It's on record. And we could find a good app that we could share all together. I think that'd be great. Okay. These are the acupuncture points. Large intestine 1, that's set 1. UB66, set 2. Gallbladder 41, set 3. Small intestine 5, set, what, I'm sorry, set 3, still set 1. Stomach 36 is still set 1. Okay. And this applies to 70% of the population. That's why you do the set 1 first. And it seems like when we did this acupuncture at the site, most people just needed these set of points and they worked. And when I did the acupuncture over the weekend outside, most people needed these points. But at my clinic, consistently, since year 2005, that's been 20 years, consistently, 70% of people need this pattern. And then the other 30% need the other set of points. That's why I'm a little bit baffled why almost everybody needs the 70% set of points to work. Because at my clinic every year, even there are 2 other acupuncturists at my clinic, see that about 30% need the set 2, not set 1 to work. So this is gallbladder 44 point, small intestine 2 point, stomach 43 point, large intestine 5 point, and urinary bladder 40 point. Okay. And urinary bladder is optional. You could do stomach 36 instead of urinary bladder. The result is still the same. There's a theoretical reason to that. And also, as an outcome benefit, the result is as good as stomach 36. So you don't have to do UB40 because it's behind the knee and it's not comfortable to access at sometimes, but you could do UB40 if you want. These are all the points that you need to know. Okay, why are we doing Bisoma? Because the result is immediate, comprehensive, and lasting relief. I think you've had that experience, I think for you and also the others who came from the neighborhood, and they had acupuncture, and it seemed like everybody had 50% or more relief that day. That was crazy. And even into that night, the next day, the relief was lasting. Don't know how long it lasts for, but perhaps for several days. And as they get more, of course, then they could maintain that improved state. What does Bisoma acupuncture? Yes, question?
So it was saying on the left or the right side for one or two,
Mm.
but I think we were doing it all on the right side.
Yeah, where did it say left or right side here? Was it on the screen?
Yeah, it says note all the 5 points are the same side. Oh, go ahead one.
Only on the right or left side of the body.
Yeah,
Okay.
only on the right or the left
Okay.
side.
Yes. Well, that's a good question. Why did we do only on the right side? It's because to have a standard.
Right. But
Yeah.
you could do on the right or the left side?
Yeah, the result is still the same.
Oh, okay.
But let's say you do right side on one person and left side on another person, then you would have to ask. If you don't have an app or if you don't have a record keeping, then you have to ask where they got the acupuncture. Was it the left side or the right side?
But you would have the same results if it was either one.
Yeah, same result. Because I
Okay.
was, for years, I did one side and then I switched over to the other side. Therefore, I saw this the same pattern happening over years of time.
Mm-hmm.
Plus, I gave acupuncture on the same side of the problem and opposite side of the problem. The result is still the same. Okay, very simple, straightforward. As long as they get what they need, sidedness is not relevant here. The reason why you do one side only is because right and left side, the 70%, 30%, or set one and set two are independent and they could occur on one, let's say set one could occur on one side and then set two can occur on the other side. Or both set one occurs on both sides, or both set two occurs on both sides. We want to know which set one or set two is present in that individual. And let's say on the right side is set one that the patient has, and the left side is where the patient has the set two. You give set one on both right and left side, the result is not going to be there. There will be no benefit. If there is a little bit, and if there is, it's very temporary. It's because it's like playing music. You got to only play the piano or with the keys or whatever instrumental music you have. You need to play the right note to make it sound like music. And it's playing fine, and then somebody else comes in and plays different notes. There's no harmony, and the body gets confused. Although you're getting the right spots, the body's confused because of the other spots that were not necessary. Then the result becomes invalidated. That's why you do one side at a time. If you want to do both sides, then you got to verify one side, right side as an example, is it set 1 or set 2? By their improvement, you know which ones are correct. And then you do the left side, set 1 or set 2. You could still keep the right side, the one that works, but if the left side, set 1 are not the correct ones, they're not going to improve. So you could either do the left side only or both sides together, but on the left side, you test for set 1 and then test for set 2. See which one is going to be helpful for them. For majority of people, only one side is enough. For some people, there's a limitation. And when they have additional optimal spots, then there is additional benefit that they get. That's why we go into that sequential order, one side at a time. If one side is enough, then add more points on the other side to make it even better. If one side is enough, then just stay with the same side, same points that work. People don't get used to it. It's just that the improvement has its limit, not that they don't get used to the acupuncture. All right. Any other thoughts? Let me know.
I have a question.
Sure.
Just wondering, like, how long should we test this with the one side? Like, how many days should we give, like, in terms of improvement? Like you said, there was like a slight improvement, but then it doesn't really, you know, maximize or,
Yeah.
it just kind of fades. It was just that one time kind of or two times. So how many times do you think we should do this trial run for the treatment?
I think you have the impression that one treatment, when they are correct spots, they have good, noticeable, immediate, significant relief. All right. What I do at my clinic is some people, if they don't have an improvement with the first set, the next visit, I give them second set. Third visit, I give them set 1 if the set 1 didn't work. I alternate like that from set 1 to set 2 at each visit. Okay. Should you do it that way, or should you do 2 consecutive times? Set 1 twice, 2 different days, and then do set 2, third day and fourth day, then compare the difference. That part is up to you. I prefer to do alternate between set 1 and set 2 because of my personality. I don't like to wait. I don't have enough patience for that.
Okay.
Right. All right, and so then that's benefit of Bisoma. All right, this method, only these spots are treating many things at once because acupuncture is not problem focused. It's person focused. That's why it's natural medicine. Because it's person focused, the person can treat itself in multiple ways all at once. So a person has anxiety, depression, or the person is having cancer treatment, then you could treat all those together at the same time because that's the way body works. And that's what we're tapping into. I think there was an example of this lady. She was having heaviness in her heart for 2 years because for 1 hour she was trying to revive this one person who was having a heart attack and he passed away in her arms. She had neck pain and back pain too. After acupuncture, her heart felt so lifted and so open. She was smiling and less bodily pain too. Yeah. So mind and the body. Acupuncture works on mind and the body because body is all nerves. Nerves go everywhere. And body has hormones. And body, of course, musculoskeletal issues. When you address the body, all things improve like that, then the message sends to the brain and the brain readjusts. Brain nerves readjust towards the good messages that it's getting from the body. Yeah, okay. And headache, tension, migraine, different kind of headaches, this treats. Hot flashes, this treats. They're crazy good with the hot flashes because let's say at age 50, somebody's going through raging hot flashes and raging night sweats. Even when they're on tamoxifen, that's something that gets rid of estrogen from the system. So then you got natural and you got chemical induced. In spite of that, with 8 acupuncture treatments, you could get rid of 70% at least. And then they only need to get acupuncture every 2 weeks to maintain the improved state. Okay. Very convenient. Okay, physical trauma, of course, musculoskeletal issues. Neck pain, back pain, or sports-related injuries. Different type of pregnancy-related issues, breech pregnancy, delayed cervical dilation, labor pain, nausea, vomiting, premature contraction. It's because there's timing. When things don't happen according to their timing, then acupuncture helps the body adjust to the timing that it should be at. Because the body knows how to do it. You just remind it. And yes, post-surgical recovery, knee replacement, hip replacement, back surgery, like big surgeries that people have to wait several months to recover from. Bisoma Acupuncture helps them to recover faster. Okay, and it's effective, everybody. I'm in LA area. Everybody's from every continent. They all have the same outcome. There's no certain group that has higher or lower. They're all similar. Two size fits all. I mentioned set A, set B. That's it. That's all you need to use. And it's convenient because it's in the hand and the leg. Same points are repeated at different times. Same points are repeated for different problems. That convenient because these points are constitutional. Constitutional means it's written in the genes. You can't change the genes. It's the way the person is born. That's how they are from birth and through their lifetime. And these points are hardwired, not soft-wired. And you identify these points, then these points are relevant for the rest of their lives. Very convenient to know. No diagnosis necessary whatsoever because there's only two choices. If one doesn't work, the other works. Only two choices. Thick and thin needles are the same. The result is the same. There's needle manipulation technique. You don't even have to do that. Okay. Why the result is the same? It's because it's like a switch. You're making connect. It's not the amplitude. The infrastructure is already there. All you're doing is make a connection and it does its job. That's why small or big or whether you feel it or you don't feel it, the result is the same. And then you may also have heard that the needle direction along the meridian flow or against the meridian flow are important. No, not relevant. It's because the body adjusts according to its need. You don't help the body along. All you're doing is making connect and everything else the body is doing. These are the acupuncture needles that I use. These are the very thin ones. And I think you also use 0.16 millimeter thick, which is even thinner. And that 0.16 millimeter is used for facial acupuncture, cosmetic acupuncture, and placing even those smaller ones on the hand and the leg, just as good. Okay, so then acupuncture on the hands and the leg, fine, that's good. You could do acupuncture on the head, additional acupuncture on the head, torso, and back. I ask you to not to add more points on the hand and the legs in case these are of the same category as a transporting or same points as transporting points. There are 60 transporting points. And that means there are 50 other points on the hand and the legs. You don't want to inadvertently stimulate those because if they are not the optimal spots, then you may not have as good of a result. Okay. Okay, yeah, convenience, easily located on the hand and the foot and the leg. You could treat high volume of patients at once. We did that. And easily learned and implemented. Do you feel like you've mastered this style in one day? Or do you feel like you could repeat it after that one day?
I mean, I've been once we left, I kept doing it every day. So I was doing it on me every day, and then I got Liam to do it on me, and then I was treating him every day too because he had a knee injury.
Okay, very good. So that means it's repeatable. After one day, you knew enough to be able to master it over time. Okay. All right. Then did you get the similar benefit as you did after that first day? Did it continue to help you?
Yes,
Okay, good.
it helped a lot, and then I ran out of needles.
Ah, you're gonna have to get gold needles so you could reuse those. Okay. Well, what
Or
about
you can reuse gold needles?
gold needles were the go-to needles until 50 years ago, since ancient times, because they're naturally antiseptic and they don't go bad, right? Gold is forever. Okay. All you need to do is sharpen it though. It does get blunt very easily and it could hurt. Okay. All right. So then, yeah, okay. Next, I'm going over this again. 70% of the population, large intestine 1, urinary bladder 66, gallbladder 41, small intestine 5, stomach 36. When you see these names, meadow well, water spring, wood stream, fire river, earth sea, just think of these as having different names because different approach, different concept. An acupuncture point is very complex because you're working on a complex being and it's comprehensive. Therefore, naturally, you're going to have different angles of looking at things. And then the other 30% of the population, gallbladder 44, small intestine 2, stomach 43, large intestine 5, bladder 40. Different names because different systems have different names to the same points. Okay. 4 steps to this. Either choose the right side or left side of the body. Doesn't matter where the problem is. It does not matter where the problem is. Just choose one side. You cannot do both sides from the start. Just do one side. Arbitrarily choose right or left side to do acupuncture. If you think the patient is going to go, I got left side pain, and why do you do acupuncture on the right side? Then you don't want to explain it, then you do acupuncture on the left side. So it's more out of convenience rather than efficacy. Okay. And of course, you first needle the 70% set, which is set 1. And you do that once or twice. Once or twice, no relief, or maybe a little bit of relief, not good enough. Then do the 30% set once or twice and compare between the 70% and 30%. Needle retention is 20 to 30 minutes. And you saw me putting extra needle in between 10 to 15 minutes after the first ones. It's because these are so small, tiny, that people don't have problem with these generally. They're not painful. And when you add more, you're ensuring stimulation. I'm not sure if you're making it better, but you're ensuring the switch to connect. Okay. Now as for the statistic, my clinic, it's been like this for the last 20 years. 1/3 of people notice high relief, 1/3 of people notice moderate relief, 1/3 of people notice mild relief. And I was scratching my head and I'm thinking, why is this? And because when I go outside, every time, without fail, definitely 60% notice high relief, 30% moderate relief, 10% some relief, or maybe none. And because there's nothing is 100%. At this rate, this is considered superb, amazing. Okay. Then how come it's lesser at my clinic or in a clinic? I think it's because majority of people that I see have stubborn chronic condition. Is it because they have stubborn chronic condition, or their bodies are such so that it leads to chronic stubborn condition because the body is not able to heal itself that well? And acupuncture cannot access that stubbornness. I hope that makes sense to you. Like, for example, my body is stubborn. It takes several treatments for me to know, oh, okay, I can see that is helpful to me. Not just one treatment, I have this 50% improvement. It takes several treatments for me to notice. And maybe the people that I see are they have those kind of bodies. They're not that responsive to acupuncture. And maybe that means they're not that well in having the automatic ability to self-heal. That's my assumption. Although I don't have any problems, I heal pretty well in general.
What about the factor of it being outside versus being inside, like the energy from the earth? Could that be a possibility?
Everything is in a tent. Okay. So then that's the next thing you want to do. We did acupuncture on the inside the other day, right? Would you have considered that outside or inside?
Possibly outside, maybe. Like,
Okay, all right.
yeah.
Maybe that's why. So then a clinic has a very hospital-like setting, very office-like setting. Therefore, it might be different. Never know. I'm gonna say everything is an attempt unless we could verify it, and I think you're in a good position to verify that. Okay. Okay. Ipsilateral means same side of the problem. Contralateral means opposite side of the problem. Bilateral means acupuncture on both sides. As long as they're all getting the optimal spots, they all have the same relief. I did say earlier, bilateral acupuncture is better than just one side of the body. But there are a lot of people that they get acupuncture on both sides and the result is as good as just one side.
Question. What about when I think you might have touched on this, doing one side with the one or with the set one and then the other side with set two? Does that affect, like, say you're not getting the result of either and maybe the person's stubborn or whatever, but like combining the two on either side, would that, have you ever tested that?
Yeah, I think in general you're gonna have to do that if set A and set B don't work. Okay. Or let's say set A works, but it has limitation. Or set B works, it has limitation. They have to improve, and why not do the other side and see which one's gonna work? Okay. And so then you are forced to explore into additional acupuncture points to use.
But not simultaneously though, right? You said we only want to activate set one or set two at once.
Okay, I'll give you a story on this. Okay, a story. For a majority of people, one side acupuncture is enough. Okay, but there are those people who have a ceiling effect. They're just improving mildly, maybe moderate, but they could have more improvement than they're experiencing. Then you're going to explore into the other side of the body and determine whether set A or set B works. Because an individual can have both sides of the body as set A, or both sides of the body having set B, or one side having set A and the other side having set B. That means you have 4 different variables. Okay.
But we don't put side set A needles at the same time, right? Because it counteracts.
Well, there will be a counteract if the points are not optimal. This is what I mean. A patient, as an example patient here, has set A on the right side, and the patient has set B on the left side. It's the way they're born. It's ingrained in them. We're just discovering which ones are working for them. Is it set A or set B? Then I arbitrarily chose set A for the right side, and it happened to work because for that individual, set A is the optimal set of points. Okay. But the patient after 10 treatments has a limitation in their improvement. And the patient is expecting more relief. I'm expecting more relief. Therefore, I'm giving acupuncture on the left side. And I will just set A on the left side first, because that's a higher likelihood that it's going to work. But it didn't work because on the left side, the patient has set B as their points. And then when I just set B, it helps them even more. Now I could do set A on the right side and set B on the left side together at once, simultaneously, bilaterally. We could do both sides at the same time, but we have to do one side at a time, make sure to find which set that the patient has.
That makes sense. Yeah, you're just trying to find the match, which one is working most effectively for which side, and if they have different sides, and yeah, you're testing it. You're going through all of the trial.
Okay. My joke about that is that we could cover everything if we could just roll over a bed of nails. But it doesn't work. You could only access the optimal spots. Okay. All right, next. Acupuncture needles, you could put them in any order. You could take them out in any order. Put them in the order of less painful. You know which points are the less painful spots, right? Near the wrist, near the knee, fingertip, toe tip are sensitive. Do those as the last, because you don't want to surprise the patient and they expect everything else is going to be as painful. So do the less painful spots first. Okay. And then the direction of the needle doesn't matter as long as you're in the right spot. Okay. That doesn't matter. Next. Subjective and objective. Okay. Biomolecular medicine is objective. Blood tests, urine analysis, and stool sample and all that. It's objective. But there's a lot of subjective that objective cannot measure. Pain as an example. Is there a device that measures the amount of pain somebody has? Does such thing exist? That's the most frequent condition a patient sees doctor for. Then how come we don't have a device that we could put on the patient and go, okay, according to the screen, this is how much pain you got. No such yeah, no such thing exists. Okay. And what about heaviness of the heart? Is there a device that measures that? No. Okay. Subjective is using your senses, your feeling, your eyes, your smell, your hearing, your taste, using all your senses. Don't you do that all the time? Every day? So aren't you good at using those? So then when patients say, I feel better, well, of course, they want to get better and they'll tell you. Whether they do or they don't. And there's a way to make sure that they're telling you straight out. It's like, are you sure? Just ask them, are you sure? Or you could say something like this. How's the acupuncture? Is it helping you? Tell me one of the three answers. Either I don't know, it's the same, or it's better. Okay. I don't know means I cannot tell. Okay. That means you gotta try set B then, right? If the with the set A is not working, they're gonna go, I don't know. Okay. And they'll say another option is it's the same. Well, because they could measure it. It's the same. Nothing's happening. Okay. Then you're gonna have to do alternate points. And then the third answer is okay, better, or it's more than I don't know. I could tell something is happening. Because people will think, what is the reason why I feel better? It's like, let's not get into the reason why. It's just too complex. We're just being logical here, okay? We're trying to think through things. Let's just compare from before and after. You're better? Good. That's what we're trying to get at. Is it more than I don't know? Is it better? Mildly better? Moderately better? Highly better? Okay, you're in that category, then we could repeat these spots, expecting that more will give them more benefit. Okay, so that's how you get to the patient's response as to what they're experiencing. All right, and this acupuncture is complementary. In endocrinology, I mentioned about hot flashes. Okay. And when it comes to thyroid issue, diabetes issue, that'll require herbal medicine. Gastroenterology, a little bit helpful with the IBS, but it'll require herbal medicine. A lot of internal medicine issues, gynecological issues, period issue, PMS issue, those things. Okay, work in conjunction with oncology. People are getting cancer treatment, nausea, vomiting, ache, fatigue, headache. Acupuncture helps a lot. Along with orthopedics, physical therapy, psychiatry. Yeah. Any industry and any level of profession, this acupuncture can work in conjunction with. Okay, cost effective. And here's a photo of two acupuncturists that joined me May 31st, June 1st. This was a week ago. And we treated, I think we treated, I don't remember the exact, we treated somewhere around like 35 patients, and patients came back for the second treatment, third treatment, even fourth treatment, and we were able to get a feedback. They came back either the same day, Saturday, or they came back next day, Sunday, and they got more acupuncture. Here, she's doing acupuncture. This is the first time she's doing this Bisoma Acupuncture and got the same benefit as you guys did. Okay. And this is the other acupuncturist.
Noticing that after
There you go.
Oh,
There you
nice.
go.
All right.
session, I'm back here
Noticing that after good 3 minute session, I'm having a lot more mobility in my shoulder, upper forearm, and right side.
Looks like she's done this before.
All right, what happened? How did you injure it? When did that injury happen?
So it happened in 2019 from a motorcycle accident.
First time, huh?
A brain surgery.
How many surgeries have you had?
Just one.
Okay, and then you said you lost like feeling? You have numbness?
I've had no feeling in my fingers, and I can actually circulation going through it now.
Oh, you feel the circulation coming through now after the acupuncture. Just one acupuncture you had today. So you're waiting for the second one, see if it's gonna help even more.
Sorry.
Okay, great. Okay, so then with the first treatment, he's able to get his feeling back.
I feel a radial nerve
Spring?
under my arm that I haven't felt in years from the acupuncture.
And this is after the second treatment?
Yes.
After the first treatment, he noticed that your arm was doing better. Second treatment was even more helpful.
Yeah, after the first treatment, I noticed the feeling in circulation to start, and after the second treatment, I feel it a lot. It's a lot.
Okay, even more so. Okay, good, perfect. So he's getting more sensation coming back. Not only that, you see the acupuncturist holding his hand because he's grasping it more than ever before. He's getting the strength coming back. Okay, and then I got another video here. Here we go.
Today I came, I had surgery on my shoulder a year ago and could not sleep on my shoulder. Last night was the first time I was able to sleep pain-free. So I'm just here again today for backup.
Yesterday you slept first time in 2 years on your right shoulder since the surgery, and you had the first acupuncture yesterday.
Yeah.
Awesome. And you're still better today by how much?
From a 10 to like 2, 3.
10 out of 10 down to 2 or 3 consistently.
Yes,
All right, very good.
thank you.
Okay, very good. I got one more video to show you. Yeah. Okay, so you can all see this.
Oh, neat. You're at a powwow.
Yes.
Cool. Where was this at?
Oxnard College, Oxnard College in Ventura, California, Ventura, California,
Cool.
between Santa Barbara and Los Angeles. Yeah, just wanted to show you.